There's been a decline in organ transplants since the start of the COVID-19 pandemic. The Organ Donor Foundation is on a drive to raise awareness about the importance of donations and transplants. Let's speak now to the organization's Executive Director, Samantha Nicol. Samantha, good morning and thank you very much for your time. Now, this critical decrease, is it attributed to perhaps the reluctance of many to set foot in a hospital since COVID, or it's the fact that organ donors are just in short supply?
It's a bit of both. With COVID, obviously, all the hospital resources were allocated towards COVID. So many of the nursing staff, doctors, etc., would then be allocated to help with the COVID pandemic. And also, we found that living-related transplants stopped during that period. So they couldn't schedule the living transplants. It was very risky for the patients who were going into hospital because patients who receive an organ are very immunocompromised. So basically, the immune system is suppressed with medication, etc. So very risky, resources not available, as well as the lack of people coming forward to donate their organs or giving consent at the time of death.
Before we get to the reasons perhaps why few South Africans come forward to register as organ donors, can you just firstly take us through the organs that are usually needed the most?
Yes, so you can donate 5 solid organs, which can potentially help up to 7 people. That's your heart, lung, livers, kidney, and pancreas, or liver, kidney, and pancreas. Your tissue can improve the quality of life of up to 50 people. So you can donate your skin, bone, corneas, and heart valves as well. So many people don't know. So you can potentially help up to 57 people as an organ and tissue donor.
And that's honestly very, very selfless. But why are we seeing so many people not coming forward? What are the common considerations that influence the decision that people make about perhaps their own remains or the remains of a loved one?
We find that the biggest factor is education. Ultimately, when people are educated on the subject, the fears, the misconceptions, really we can address those problems and people understand how the process works. Many people think, for instance, that the body's disfigured or they can't have a funeral within the same day with certain religions. And all of those factors, once people are educated on the subject and understand it, they feel a lot better, they feel comfortable. But education for us as an organization that is very limited in terms of funding from government, etc., we need to reach people on the ground, and that is extremely expensive. We go into hospitals and clinics, and we do currently do that with a fantastic group of volunteers and our staff, but it's extremely expensive exercise to train people one-on-one about organ donation and tissue donation.
And hopefully we can have more of these type of interviews because it is important. I mean, the number of lives you save. You say that, for instance, if you talk about those that bury on the same day, Islam, in that instance, you're saying that if there were certain organs that needed to be removed from the individual, it would still be able to be done in the same day and then allow them to have their burial? Is that what would ordinarily happen?
Absolutely. So if there's certain restrictions, what would happen is the family would be spoken to by a transplant coordinator. They'll explain the whole procedure, and organs are removed when someone is on a ventilator, brain dead. So you've got that situation where the family are spoken to and they can make that decision. And hopefully the loved one has discussed it with them, because that's very important that when you register as an organ donor, you need to talk to your family and tell them that this is your wish. So they can respect your wish because they need to ultimately give consent at the time of death. So what happens is the coordinators, not the Organ Donor Foundation, the medical staff that approach the family would address all the problems, issues, concerns, etc., and make sure the family are comfortable with the decision and that they understand. But they would definitely look at aspects like respecting the person's wish to be buried within the same day, as an example.
In the interest of time, how do people reach you, or is it possible for them to go to the hospitals where they are? They can just perhaps notify a nurse that I'd like to donate, and then they would offer them the information.
Best thing is to come to us because we are the ones that sort of educate the public about it. So talk to us. You can call us toll free 0800 22 6611 during office hours. Got a fantastic website, Facebook page. The website is odf.org.za. Very short registration form, no tests involved, no cost involved. Sign up and our call center will call you to give you more information.
Wonderful. Samantha, thank you very much for your time this morning. That's Samantha Nicol from Organ Donor Foundation. She is the Executive Director there, and that's where